what I wanted to do today is talk to you all about there are a lot of clients now at home that are a lot sicker than they used to be. There's also hospital at home that some people are doing, and people just don't want to go into a facility for a lot of different reasons. So when people at home are need a lot more care, we are part of that because there may be a home health agency in there, there may be PT, OT, but then we're still there to do those ADLs, and those ADLs are a lot harder because of the condition of the client. So that's what I wanted to go over today. We didn't see as many years ago, but we're seeing them more and more now. And I think a lot of people, most people didn't want to go into a facility even before COVID. But after COVID happened, and they had to be in that facility and they couldn't get visitation and so much went on, people really are trying a whole lot harder to stay home now. So I wanted to, since our group is not, really totally healthcare literate, I wanted to tell you what a high acuity client is. And that is what I just said, someone who is very sick, their health is fragile, they may have diabetes, heart disease, they may have oxygen, arthritis, they may have all of those things, and they need extensive assistance with all of their ADLs, or some of them, or they may be bedridden. And they may have severe disabilities, chronic illnesses, maybe kidney disease, or advanced age. I thought that was interesting they put that in there, because there may be someone that is 95, 96 years old, and they're still able to live at home, but they're getting so much older that if they fall, it could be fatal. But advanced age, and we know that the population is aging a whole lot more. So that's how we're going to define that. For the home care agency, it starts with the RN supervisor. The RN for your agency is really important. I'm not going to talk about companion care at all today, because if this client is this sick, they are not a companion client. So the RN does the assessment and she assesses all of these 5 ADLs. If you're licensed in the state of North Carolina, these are the 5 you must assess: bathing, dressing, mobility, eating, and toileting. So your nurse goes out and she does the assessment for all of those areas. And then if she notices that that client needs some extra equipment, then she may get in touch with his or her doctor and let them know they need a Hoyer lift, or they need some other things to help provide proper care, and also to prevent your clients from being, your aides from being injured, And then the RN is really an integral part of making sure that that client is appropriately assigned to a caregiver or aide based upon the assessment. So just very briefly, we know that if that client has more than 2 ADLs that are extensive assistance, they have a cognitive impairment or significant pain from any of those conditions, then that particular client may very well does have to have an aide that's on the nurse aide registry. So what I've been finding is that the nurse goes out and does the assessment, and then she hands the paperwork and everything back to the agency. The agency may let a scheduler do the assignment. And we know that a scheduler does not know how to assign based on that information. She may say, oh, so-and-so is available, I'm going to give this client to her. Is it close to your house? Can you do it? So if a scheduler is involved with assigning the aid to the client, she may not even understand that assessment. It may be, okay, it fits in Jane's schedule. She's down the street. So Jane is a PCA, which is what a lot of you all call it. Let me just send her there. Well, the nurse needs to stay somewhere in that process. Or when she hands that assessment off, she needs to say, this person needs an aide on the nurse aide registry, because that's what the assessment has dictated. And then the other duty of an RN is to communicate with the physician or the home health agency regarding changes. If there is something you're not supposed to address it, but you are the eyes and the ears of that client for whatever additional care they need. So say you get a client and they used to be on oxygen, they've been taken off, but the aide has let you know that they're having a lot of trouble breathing, and they have a pulse ox and you took it and it's down to 89 every now and then when they get up, then they may need to get their oxygen again. But it would probably necessitate, now some of them, once they go off oxygen, they keep it in the house and they say, put it on as you need it. But if it's no longer there, you may need to call the doctor and say, Miss Jones's pulse ox is, constantly hitting 88, 89 when she gets up and walks around. She may need her oxygen again. The doctor may have to place another order. If there is a home health agency in there, and they're working with the client, you may want to let them know, and then they can go to the doctor and get whatever orders they need. So the key is, as a home care RN, you need to make sure that the right people know what's going on with that client, so that you hand that off in the way of, this is what we see, this is what we think, you need to look at them, whatever that is. We need to get it off our plate. If that is a situation where we can't get it off our plate and there's nothing we can do, then we probably know that client is not appropriate for our agency, because all we do is ADLs. And once we report it and nothing happens, you may have to discharge them, because you will be working out of your scope, or you can't provide safe care for the client. So next, let's talk about the aid. I said this right up front. If the client has all those extra needs and they're high acuity client, they're going to need an aide that's on the nurse aid register. And then you need to be sure they have the appropriate training, equipment, and resources, be it a where you live, whatever it is they need in that home to help them to provide the proper care. And then the aide needs to have a clear understanding of what should be reported. When I was running my agency, I had a whole list of things that I wanted reported to me. And they were things like, is the client not eating? Are they having nausea and vomiting? Are they bleeding? It was all these things that I wanted. Do they have a skin tear? I wanted to know that immediately, so that, because they're seeing the client every day and they see those changes. Aides can notice little bitty changes in a client because they work with them on a daily basis. If it was significant enough, I wanted to know about it so that I could decide whether I wanted to call their doctor and say maybe they should come in, or call their family member and say, you need to take your mom to the doctor because such and such is going on. But make sure that I did something, as back in the day, they would say, a prudent nurse, someone that's paying attention to things that are going on. I would make sure I handed it off to the right person. And by all means, document, document, document. If you do that, document what you did. And then if you see nothing happens and you've told all these people and no one has done anything, you might want to send that client to the ER, or you may have to discharge them. But if you have to discharge them, you go through a lot of protocols in order to do that and follow all of the rules. So for the aid is key to keep you abreast of what's going on in that home with that client. That is their job. And that's something you have to teach them that and tell them exactly what that is. As far as the agency director, I misspelled that. I'm sorry, y'all. Just saw it. The agency director has the overall responsibility for everything in the entire agency. So a lot of you, if you're a nurse, you are the agency director and you are the RN. So everything that happens in that agency, you're responsible for that and making sure that things happen the way that they should. And you must ensure that all the training and resources and all of that are happening for your employees and for the client, so that the care is done properly. You need to make sure of that. And then the agency director establishes and enforces the rules and policies for what should be reported, when to report changes in the client, and the protocol for reporting. Now, your protocol may be, we are not going to have them call the RN, they're going to call the agency director. and then the agency director can go ahead and get with the RN. Just how are you going to handle that and make sure that the aides know exactly how they need to report whatever it is that's going on in the agency or with the client. But the key is, as these clients are sicker and sicker, and we're trying to take care of them, we need to be sure that we are taking care of that and handing off any information or things that need to be done for that client that we cannot do, that is out of our scope of service for our agency. So as I tell you all every month, I'm always available to provide information to you all as far as anything that I find out or I'm following here and there, or things that come to me. I like to give this information to you. But before you change anything in your agency, please go and make sure that you talk to the authority that governs that. If it's a home care licensure rule, check with them. If it's something regarding taxes or employment, whatever it is, go to the governing body and make sure that it's okay with them that you make those changes before you make it based on any information that you hear from me. So that is what I had prepared for you all today. And what I'd like to do now is, do you all have any questions or any input that you'd like to provide based on what I've shown you today? Because I feel like this is really important. And as I said, as the acuity goes up on these patients that are in the home, we are part of that, and we've got to be a little bit more diligent about making sure that we hand it off, pass the information along to the right person so that the care is provided in the right manner. Any questions, anyone?
Thank you, though.
Okay, yes, just be mindful, you all. There's a lot that you have to pay attention to, but I just want you all to make sure that your nurse agency director, that you're communicating in the right way. Nurses know this. They know how to do this. When they were working in the hospital, if they walked in a patient's room and she was fine, or he or she was fine when they came on to work, and then 2 hours later they went in there and the status had changed, they go and check the orders and there's nothing that they're supposed to do that's already written, they immediately call the doctor's office. So we do that in home care as well. It's just that we provide the information and then we step back, make sure that it happens, but we don't do everything. But it's still, we still have the duty to be sure all our clients are okay. All right, any questions, y'all? If not, I said I wasn't going to be long today. I know you all have a lot to do, and so do I. So we can go ahead and close, and I will edit this video and get it up on YouTube. And we will see you all in April, because this year we're doing these every other month. So we'll do this in April, and I will let you all know. Okay, here's a question. Can you open your mic, please, and speak? Okay, it says, when we were not able to provide service to a client, we handed them over to another agency.
Hi, Patty. Sorry about that.
Over to another agency. What if we're understaffed? Can we use their RN? Explain that, please.
Just asking, because if we're not able to provide service and we hand over the client over, or the resident, to another agency, does that go also for staff? If we're understaffed, could we use their aides? Could we use their RNs the same way?
It depends on what type of, just keep in mind, everyone that comes into your agency and touches your client that's under your care, you need to hire them. If an RN is touching your client, or she's under contract, she needs to have some contractual something with you as far as the RN. But as far as an aide, they would probably have to work for a staffing agency to come in and provide care. Just be sure that you have that aide has been vetted, that she knows how to perform her skills, and he or she needs to come from a staffing agency, or they need to be your employee. I don't think you should just be out there, if an aide works for ABC agency and she can come over and work with your client, then are you under contract with that other agency? just keep that in mind. That you
Okay.
can't just pick up an aide off the street from anywhere and not know her background or anything about her just because she works for another agency.
Okay. Thank you.
If it's your client. So there's a lot of things there that you need to consider. But if they're an aide and they're an RN, legally they can work with your client, but you need to have a contractual agreement, either an employee or a contract, in order for them to work.
Okay. Thank you.
Mhm. Are there any other questions?
I had a question. Is it acceptable to start care with a skilled PCA while you're looking to hire a CNA for some of these acutely critical high acuity need clients?
I guess you could, Carrie, but that would not be what the home care licensure rules say. They say that if that client has been assessed with however many ADLs that are extensive and all of those other things that I mentioned and those other variables, that they should have an aide on the nurse aide registry. Now, I will say there's reality as well, but where I think you could be a little bit better off with it is that you assign an aide that's on the registry. And what if something happens and she can't go to work for a day or two? You might want to keep, in order to keep that client from having no care, you might send someone that is just a PCA on a temporary basis because you know your aide is coming back. That's not necessarily good either, but it's better than assigning the wrong person. So where this comes in, Carrie, as an RN, it would be inappropriate delegation. That's where the nursing board would come in and say, you delegated those tasks inappropriately to a person who was not skilled or qualified to do that under your home care licensure rules.
Okay, thank you.
I don't see any other questions. Anything anyone else came up with while I was speaking? Okay, well, it was good seeing you all today. I hope we didn't miss too many people because they didn't have the passcode. But as I said, I'll edit this video and get it up on YouTube. And thank you all for coming. Stay in touch with me and I'll do the same for you all. Probably on those alternate months when we're not meeting, I will probably put up a video or an interview or something like that to help us along the way. You all take care and stay busy. And I hope you all have a wonderful year in home care. Thank you all so much. Goodbye.